morning and welcome to this session of the Tourette Association's virtual conference. My name is Chelsea Tolner, Director of Outreach and Education at the Tourette Association of America. Thank you so much for joining us this morning for Resiliency with Tourette. We would like to take this opportunity to thank our conference platinum sponsors, MLS and David Amundsen, our diamond sponsor, Oracle, as well as all of our donors and supporters for making this free conference possible. To help us continue to provide educational programming, please consider making a donation. Your gift will assist the TAA in continuing to provide critical support and resources to the Tourette syndrome and tic disorder community. Please visit tourette.org/donate to make a contribution today. During today's session, we would love to hear from you and include your voice in the conversation. You can ask questions or share comments using the question panel on the right side of your GoToWebinar player at any time during the presentation. We will collect your questions and address them during the Q&A session at the end of the presentation. It is now my pleasure to introduce you to our presenters, Dr. Joseph McGuire and Joseph Sexton. Dr. Joseph McGuire is an assistant professor in the Department of Psychiatry and Behavioral Sciences at Johns Hopkins University School of Medicine. He has over 10 years of research and clinical experience in the assessment and treatment of Tourette disorder, obsessive compulsive disorder, anxiety disorders, and related conditions. Dr. McGuire has received numerous national and international awards. He has co-edited 3 books, published over 90 peer-reviewed journal articles, and has given dozens of conference presentations. Dr. McGuire has gratefully received research support from the National Institute of Mental Health, Tourette Association of America, and the American Academy of Neurology. Joseph Sexton, TAA Rising Leader from 2019, is a rising sophomore at Vanderbilt University, where he is supported by the university's premier Cornelius Vanderbilt Scholarship, is a member of the College Scholars Program, and is the founder and president of the Vanderbilt Alliance on Disability and Condition. Joseph was featured in the Atlanta Journal-Constitution as his high school's most outstanding senior in May 2019, and has also received national and international recognition for his research on major depressive disorder. Other notable accolades include acceptances to some of the United States' most selective collegiate institutions, including Harvard, Duke, and Notre Dame. He attributes much of his previous success and professional development to his ability to find resilience and persevere in the face of his Tourette and other perceived adversities. I'll now pass it over.
Hey everyone, so welcome to the presentation. We're excited to be sharing with you guys today some perspectives on resiliency. So I'm going to be giving more of a personal perspective and sharing my story, while Dr. McGuire is going to be giving more of a clinical perspective, I think, on how to achieve kind of the things I'm going to be talking about. So one thing I want to say before we start, and as we're at the beginning of the conference as a whole, is that this presentation is not just about Tourette. And I think anyone here that has Tourette can agree that the tics are just the tip of the iceberg. And I'll be ticking continuously throughout the presentation. But so much of the things that come with Tourette syndrome that are things that we struggle with are the lack of community at times. It is the comorbidities. It is the faces people may make at us. And so much of it is just beyond the Tourette. So I want to bear in mind throughout this presentation that a lot of what I'm going to be talking about is general. It can be generalized to greater forms of adversity, however you may experience them as an individual. So without further ado, let's go ahead and get into the presentation on deriving opportunity from adversity. So an introduction, just to give a background on me, I want to give you guys a little bit more context of who I am. That's me. I'm a student at Vanderbilt, but I think in the context of the presentation, where we're going to be talking about kind of these forms of resilience and accomplishments that people with Tourette syndrome and other adversities oftentimes think that they can't accomplish, or that are lesser broadcast in our community. I was accepted to some higher up institutions. I put Duke and Harvard here, but you can really kind of go wherever you want with education with Tourette syndrome, despite what you may think. At Vanderbilt, if you're interested, I'm studying some sort of mix between psychology, public health, and statistics. I'm not exactly sure what's going to happen yet. And I've been really involved with research since high school. That's a picture of me at the International Science and Engineering Fair in Phoenix last year. And I live in Atlanta, Georgia, well, about 45 minutes north of Atlanta, Georgia, with my family, who's pictured here at my graduation last year. So let's go ahead and get into it also with my experience with Tourette. I was diagnosed in the summer of 2015. So it was, just to give you some context, it was a rather late diagnosis. I was age 14. And I thought I was in that, 10% that didn't have any comorbidities, but I very quickly realized the tics, like I said, were just the tip of the iceberg. And I developed pretty problematic OCD in January of 2016. So I was age 15 then. And at my school, I really had one mentor with Tourette syndrome. And I think any of us with Tourette syndrome, or anyone that knows someone with Tourette, they understand how isolating this condition can be because it's not necessarily common. It's more common than we may think, but at the same time, so many of us don't necessarily have that community or someone to lean on. And that's something that is very, very crucial, I think, at a younger age. And especially for me, that was my first year after diagnosis. It was my first year entering a public high school. And having Logan, who was this mentor, was pivotal to my understanding of myself as having Tourette and how to navigate the challenges that are associated with it. So with Logan, I started an association actually at my school to fight stigma. And it was just a Tourette's awareness club. And it was basically a way of saying, because I was facing this constant issue of people asking, why are you doing the things you're doing? And that was a sentiment that was shared by Logan too. So we just started this club, and it was as simple as saying, once a month, we'll be in the library on this morning before school. And, if you have questions, you can just join us then. And it worked pretty well. And I've continued this endeavor in advocacy as a rising leader going into college with that training that the Tourette Association offered last summer. So here I'm going to give some background on Logan. Logan is that mentor that I had. He's pictured here. He was always a super fun guy. He was my mentor. And again, we started that Tourette's club at our school. But what I didn't realize, and this kind of goes into the theme of greater adversity, was that Logan was struggling with the comorbidity of depression. And this was something that we weren't necessarily talking about. And he was particularly struggling with the summer in 2016. So that was going into my sophomore year. And unfortunately, he committed suicide on August 5th, 2016. So when I'm talking about adversity, in my grand scheme of Tourette, this was the single greatest adversity that I faced. And it didn't have to do with tics. It had to do with this loss of community and not talking about things that were outside of the tics. He was helping me so much with my tics, and we were talking about tics a lot. We weren't talking about those comorbidities and those harder topics like depression. And it leads to the question of, how do I move on and cope? It's especially problematic because I was always kind of a high achieving teenager. I wanted to go to college. I wanted to go to a good college. And when I was having difficulty functioning myself, it was a question of how can I cope while also, enacting that resume development that you want to be doing in high school in order to accomplish the things that you want to accomplish. So I decided I wanted to cope by preventing further harm. And that is something that both was helping me and was also helping my resume. And there's a lot of what I'm going to be talking about today is just developing resilience in a way that you can use your adversity to actually benefit yourself, both emotionally, but also from an objective standpoint. So for one thing, I expanded my organization, that Tourette's organization, to include all kinds of conditions. So, that was one of my biggest shortcomings, was that we were just talking about tics, and I wanted to expand that. So now we had an organization that was talking about greater things, not just tics, but also depression, self-harm. We had students actually coming in and presenting on other conditions, cerebral palsy to schizoaffective disorder, and that range actually just grew. And it actually really took off at our school too. I think by the time I was a senior, we had so many people wanting to present on these unique conditions they have in order to find the sense of community that some people didn't necessarily get to present, or we had to schedule extra meetings so that they could. And beyond that, I also was always involved with science fair. I've always loved science, and I loved research. So before all this happened, my science fair projects in middle and high school were kind of more based on sociology, and I was doing things on, say, like peer pressure. But after this all happened, I decided that one way I wanted to cope was just by reading. And I kept reading and reading on things like Google Scholar and ResearchGate, just article after article that was relating to depression and OCD and Tourette's and what was the intersection of them. And that eventually led to me doing these science fair projects that were very pertinently related to psychopathology and mental health and the neuroscience of it all. And the resume just kind of develops in a cascade and it snowballs. And then all of a sudden, by my senior year, I was actually working in a lab at Georgia State University, doing this kind of long commute back and forth to Atlanta. But it was great. And I found that I was actually helping myself in these ways because it was helping me emotionally cope with what had happened. It helped me understand what had happened. And at the same time, it was developing my resume. So I was really getting a 2-for-1 deal here. In addition to that, I also realized that it just made me a better person. So beyond this objective stuff that we're talking about today, I think it also, you can realize adversity makes you have deeper conversations. It makes you have deeper connections to people, and it enables you to better sympathize with people. It also enabled me to just write. And I think that's something that's a very universal skill that everybody needs. I was doing a lot of poetry, but I was also reading a lot online. And I think it really bolstered my writing skills. And ultimately just realized that it helped me realize that I needed to be doing something to challenge my adversity that would also alleviate pain. So, it was on one hand showing that I was really stepping up to the task of challenging this adversity that I dealt with, but it was also just helping me as a person. So now I'm going to dive into some more specifics. This is going to be tailored a lot to high school students, college students, but I think a lot of it can actually be generalized to anyone that's kind of pursuing a greater passion or trying to define their goals in life. So one opportunity that I want to talk about to cope and share your story is the science research that I talked about. So if you're in high school, I put some opportunities that, or if you have someone that's in high school that has Tourette syndrome or any form of adversity really, I put some details and some specific ones through a General and Science Fair, which goes from all the local levels. I had one for my county in Georgia to all the way to an international level. And you also have the Junior Science and Humanities Symposium, which works similarly at a national level. Then you also have Harvard's Journal of Emerging Investigators. And these were all things that I interacted with in high school. And every single time it was related to research I did in depression. And again, it was helping me deal with my own story while also accomplishing things that were objectively moving up my resume. So my sophomore year, after everything with Logan happened, I started coding a program with my friend and I started testing it on my friends. And I realized that some of my friends that had told me that they had sort of these depressive symptoms, they were responding differently to the program. That's the long story short. And the research just kept going and going. And again, I was eventually working in a lab and I was doing collegiate level work. And now I'm in college, still doing work related to depression. And that just shows one specific instance through science research that you can actually integrate your own personal story while still accomplishing some objective good. And I want to say that just because you have Tourette syndrome does not mean that psychology or neuroscience are your only outlets for research. There's so much you can do in any field of science that you can relate back to your own personal story, especially when you consider that Tourette has such a worldly impact beyond just the tics. It's something that affects you in so many different ways. And then moving on, there's also art and writing. I think there's a lot of people here that might be saying, well, I'm not STEM oriented, or my friend or my son or my daughter are not STEM oriented. Art and writing is a skill that everyone needs, whether you're STEM oriented or not. And some people are particularly gifted in it too. And these are just another couple examples that I didn't interact with personally in high school, but I knew about through the Scholastic Art and Writing Awards, Young Arts, poetry slams, which I actually was involved with poetry slams a good bit. And again, these are skills that will benefit you constantly through life. If there's anything I learned as an undergraduate student, it's that I'm glad that I learned to write a lot in high school. It is helping me a lot as I'm doing papers and giving presentations. And I just want to say here that something you may be wondering is, I'm talking a lot about almost abusing these conditions or these conditions of adversity so that you can kind of find your own benefit. Your work does not need to be defined by your adversity, but you can leverage it when you want to. And it's a way, again, to alleviate your own pain. And I really don't think that you should feel guilty about it. But when you want to, you can just bear in mind how it affects your lifestyle. So you don't really need to be writing about it. There's this kind of expectation that if you have Tourette syndrome or some other specific adversity, whether it be racial or in terms of orientation, that you're supposed to be writing about it. And you never have to be writing solely about your tics, etc. But again, you can kind of just bear them in mind and leverage them when you need to, both as a form of kind of alleviating any emotional pain that you're going through, while also bolstering yourself academically. And then there are other fields that can be related to your story. So work in policy. The Tourette Association, for instance, is doing so much. They do this trip to Capitol Hill every year where we talk about mental health reform. And there's a need for representation, for mental health reform, for access to healthcare. And, in high school and college, I see that in Model UN. There are plenty of opportunities that you can work in policy and, again, relate that back to your story. If you want to work with youth, I know people from the Tourette Association that were in my Rising Leaders cohort that work in special education or that work in education with young people, because so many of us have not necessarily been served properly by the system, or we've been misunderstood throughout our early education. And that can give you an aspiration and unique perspective on education and interacting with youth. Working with animals is something I also put, just because I know that many people with Tourette syndrome have kind of special interactions with people with animals or with animals themselves, as whether they be as service animals or I know I've had pets throughout my life that have been really key to my stress management. And I think that, again, gives me just a greater appreciation. And I think in all of these things, now I'm leaving with this overarching question of, can anyone do research or write about any given issue? And that's true, but they can't do it with your story. And why that matters, I'm going to give some specific instances. Let's look at the common application prompts for next year. So some of you are getting nightmares of your college applications, and some of you are sweating bullets because you're thinking about how you're going to be applying to college now. And the common application is this big cohesive application that goes off to every single college that you apply to. And these are the prompts for next year. I'm not going to read them out, but you can kind of look over them. And what you'll notice is that overarchingly, they're asking you about your personal story. And Tourette syndrome and other forms of adversity give you such a great thing to write about. But you don't want to be writing just about your perceived adversity and saying, this is what happened. This is how I was bullied. This traumatic thing happened to me. If you're ready to talk about it, you want to be able to say that you actually did something about it too. And I know that can sound like a bold statement, but really what this means is that you're able to kind of look at your experience and say, this is what happened to me, and this is how I responded. This is how I helped myself. This is how I responded on an emotional level, but also you bolstered your resume. And you can say that you actually did something. So yeah, I wrote my common application essay about, my experience with Logan, because it was something that was very important to me. But I was also writing about how I responded and my emotional coping with that. And a lot of that was just science. And I think colleges really, really like that as reflected in the places I was accepted. And beyond that, let's go into the professional workplace. I think there's a desire for adversity and this applied resilience. We are living in an age where unique perspectives are in demand. So when I say that, I say that in the note of 75% of Americans believe diversity is somewhat or very important to promote in the workplace. And I know at least to every place that I've applied for an internship, there is that sort of Title IX statement where people are saying that they're not discriminating based on things like sex or orientation or race or disability, including Tourette syndrome. And I think on that note, you can still say that there's still some issues that we may face in the workplace and even in education. But I think that, at least in my experience, I have found that people have really appreciated my unique perspective, especially when people ask, why do you want to do what you do? In order to wrap up this presentation, it is imperative for you to have a purpose for your goals. Everybody is going to write their personal statements and why they want a position and their cover letters on, their end goal of what they want to accomplish with their life. But I think it's also important to say what's motivating you to want that end goal. And on that note, I really hope that you've learned something from my half of the presentation, just talking about resilience from personal perspective and how you can actually leverage this sort of emotional coping with your condition while also accomplishing a lot of objective good. I'll hand it over to Dr. McGuire now. I'm going to go ahead and give him my keyboard and mouse access. And you should be able to take control now.
Oh, technology is an amazing thing. First of all, Joseph, thank you so much for that enlightening presentation and really for sharing your story. This is the second time I've ever tried to do one of these Zoom or GoToMeeting presentations, and I totally get how challenging it can be without any sort of feedback, which now gives, usually there's an audience and you're kind of getting that, and it totally gives me a whole level of appreciation for kind of late night shows and what they're kind of going through. So I'm going to talk a little bit about the other half to what Joseph kind of brought up. How do we kind of build resiliency? Right. For some people, this is an innate talent, but how do we kind of go about that? In terms of relevant disclosures, I receive some grant support. I do some consulting, but probably the most relevant one is I'm going to talk a little bit about one of these books over here to the right, the treatment and management of Tourette syndrome, that really focused on how do we kind of treat patients and families as a whole rather than just focusing on the tics. When we talk about kind of tics and Tourette's, this is a great kind of GIF, however you say it, but really kind of highlights, we always think of tics. Everybody thinks, that it's just about kind of tics, and tics is Tourette's. And I think the TAA has done a fantastic job about moving the conversation beyond that. And through this, you really see that it's just the tip of the iceberg. Right? It's not just having motor and vocal tics, but there's all these challenges that come along with this. Sometimes these are the things that, Joseph kind of mentioned, where you're struggling with depression, for his friend. You're struggling with OCD, you're struggling with anxiety, but sometimes these things don't even have these diagnostic labels. These can be things like just general anxiety, worrying, bullying. How do you kind of cope with all these things that maybe don't necessarily fit an entire label? On top of all of that, how do you kind of think about going to college, handling all of these other kind of life situations? Even beyond that, what about having a romantic relationship, a partner? How do you kind of deal with all of these things? We don't really have great treatments for that at the moment. And it hasn't really been well studied. On a positive note, there are evidence-based treatments to help people kind of manage, tics. When you think about what, the American Academy of Neurology guidelines, there's another presentation, I think tomorrow, I forget, walking people through this, but really the first line of treatment is providing psychoeducation about Tourette syndrome. What is it and what is it not, and what's the kind of general clinical course? This is really important to kind of let parents, families, and young people really know what to expect and what kind of comes along with it, not just focusing on the tip of the iceberg. The next part is really behavior therapy. And, there's two kind of general lines of this habit reversal training and the comprehensive behavioral intervention for tics, which is a study that got done in 2010 in children, 2012 in adults, and really is widely accepted as the first line kind of treatment for managing tics and managing the things that kind of come along, the motor movements and the vocalizations, as well as premonitory urges. If I don't click on the wrong part of the screen, you'll see that it's a recommended first-line treatment. And this is a huge shift from the way things were doing when I first got into the field, being involved in those CBIT studies way back in the day in 2005 or 6. At that time, really medication was the kind of frontline treatment. And now over the past 10 and encroaching on 15 years, you really see that there's been a shift towards really teaching and kind of advocating for behavior therapy, which is awesome because that's what I do and it makes me feel like I can do something. For when behavior therapy doesn't work or it's too hard or tics are too severe, you really think about kind of tic medications, and those are kind of alpha agonists and antipsychotic medications. Again, that all of these things are great at reducing tics, reducing the severity of tics, but they also all have some limitations, right? Some of those are limitations in my ability to navigate technology. Yeah. Here we go. So what are some of the limitations of behavior therapy and just in general evidence-based treatment? First and foremost, people get better with behavior therapy. When you use the skills, they get better, which is awesome. That's great. But one, it's really hard to use the skills. And even when you use the skills, not everybody gets all the way better. These clinical trials done by John Passantini, Sabina Wilhelm, you see only about 38 to 53% of people exhibit clinically meaningful benefit from behavior therapy in 8 sessions over 10 weeks. So there's more that we can kind of do to get people better and to get those kind of therapeutic results that we want. Long-term outcomes are positive, right? When you use the skills, you get better and you stay better. But when you look at some of these studies, most of these things are tic specific. They're not generalizing, to all these other kind of conditions that are under that level of the iceberg. You think about Joseph's story, these strategies would help managing tics and when tics are kind of getting in the way, but they're not going to handle OCD. They're not going to handle depression or anything else. And I think, there's some kind of thought of, with Tourette's, there's all these other things and our treatments are really kind of focused on tics at the moment. For medication management, again, similar to behavior therapy, it's not going to take care of all of your tics. And I think that that's something to kind of remember, whether you're a patient, a family member, a psychiatrist, psychologist, and if you're taking medication, there's a lot of side effects that can kind of come along with that. It can kind of get in the way, and then you have to balance that question of if my medication is making me really tired or really drowsy or really groggy, is that kind of impeding the quality of life that I want? So really what we need to kind of do is develop strategies and ways to, not only manage tics, but also kind of address those tic-related challenges, right? So how do we kind of build resilience? How do we build coping? And how do we move the conversation beyond just kind of tics? And what does a treatment kind of look like for that? So, I hope you kind of got from the last two slides that all of our evidence-based treatments, they're really focused on reducing tick severity, which is a huge success and really awesome because for a lot of people, ticks get in the way. But there's a lot of other stuff that kind of go on beyond just ticks. So we're going to kind of focus on a treatment and develop a treatment to build resiliency, reduce impairment, and really improve people's quality of life. It not only has to have kind of strategies to manage ticks, but it also has to kind of address, things that get in the way. If I am, in school and my ticks are getting in the way there, or it's hard to focus, or, my ticks are making it hard for me to make friends, how do we kind of address that? How do I talk to people about having ticks? How do we manage ticks at home if, one child has ticks and the other one doesn't? Um, and how do we kind of focus on not just clicking the wrong button, improving quality of life? Because at the end of the day, ticks in a certain percentage of people will kind of start to drop off in later adolescence and early adulthood. But really, it's about kind of building in the skills and kind of developing coping skills to really improve your quality of life, um, and building effective coping, right? So, and going back to Joseph's story and what he shared, some people have natural abilities to do this, right? Joseph, it's not like, and I don't know this, and I probably should have asked beforehand, Joseph. It's not like you went to therapy and you worked with somebody who's wearing a tie and has a quirky painting behind him to learn all these things. You have these innate abilities, and you're able to kind of take it and actualize and move beyond. Not everybody does, and that's okay. Or some people may have some abilities in some areas, but not others. So how do we help kind of get everybody to that same level to really achieve, effective coping and improve that quality of life so that they can do the things that they want to do? So really you need and I messed up on the font here, guys. I apologize. Really, if you're thinking about building a treatment to kind of help people build resilience, you got to have some general core things going on. Psychoeducation about kind of Tourette syndrome. Really thinking about evidence-based behavior therapy that we talked about, habit reversal training, comprehensive behavioral intervention for ticks, and also, medication management. Really addressing the kind of tick-specific things. But there's a lot of other stuff. How do you have a conversation with somebody about ticks? How do you cope with ticks in social interactions? Do you disclose to everybody, or do you disclose to your close friends and not others? How do you not let ticks affect your self-esteem or how you even view yourself? Because that can really get in the way in terms of, achieving the things that Joseph talked about, in terms of kind of moving forward into college, in terms of overcoming those levels of adversity. We know ticks at home can be kind of challenging. A lot of times people may not want to go, if you're a younger kid, may not want to go to a sleepover because of ticks. You may not want to try out for a sports team because of ticks. A child may struggle to kind of, manage their emotions and their behaviors because they're so frustrated, and how that affects the entire family. So really strategies to kind of help people not only navigate social challenges, but also ticks at home. And then on top of that, strategies to manage ticks at school. How do you kind of overcome, the hurdles? How do you manage? What's the difference between a 504 and an IEP? What about these vitamins that I've read about online? What about, mindfulness? What about all these other kind of healthy habits? How do I manage kind of mood, right? Unrelated to ticks and related to ticks. If I'm anxious, if I'm depressed, how do I kind of develop those coping skills? And even beyond that, at the end of the day, how do I kind of come up and start thinking about, moving beyond the ticks and maintaining these gains? Because you don't want to always be in therapy for the rest of your life. And something that, is able to kind of be flexible and adaptable to each individual person's kind of need. So, what we did back in 2015, and I'll kind of share a little bit about, my own story with this, is I had the pleasure of working on those CBIT studies showing that behavior therapy is a really powerful thing to help people manage their ticks. And there's so many success stories that I could kind of go over again and again about how people got their lives back or were able to kind of do the things that they wanted to do because of their ticks, or because they were able to use behavior therapy to manage their ticks. But there's so many other people who said, great, I'm able to manage my ticks. There was one particular adolescent I remember who was like, great, so now how do I talk to girls about my ticks? Because they're still going to kind of come on up. Or how do I kind of manage this? Do I tell my teachers? What do I kind of tell people? How do I cope? How do I move beyond? I feel different about my tics. We didn't kind of cover that in behavior therapy. I just don't feel like I'm normal, whatever that means. So how do we kind of move the conversation beyond that? So I worked with Eric Storch down at the University of South Florida, and Tanya Murphy and many others down there, to really kind of start to consider this idea of how do we move the conversation to really coping, or what we kind of use the phrase living with tics. But it's really taking a cognitive behavioral approach, not just to focus on the tics, but to really address all the things that come along with the tics, in addition to kind of behavior therapy. So we piloted out some work in a 10-session kind of treatment protocol. So can we actually kind of teach these skills, and what are these skills that kind of people might benefit from? And we ran a small case study, looking at 8 people through a kind of open case series in clinic, and really individualizing the skills to the patients and the families, as opposed to a lot of other treatments that kind of basically say, great, we're going to run you through the first chapter, second chapter, third, and fourth. Kind of taking that initial visit and saying, hey, what are your needs? We have this whole kind of smorgasbord, if you will, of skills. What are your needs, and how can we kind of help you learn the skills that you want to learn to achieve the things that you want to do, so we can make sure tics aren't causing impairment and we're improving your quality of life. And we did this in a case series. I think we had 8 kids in that one, and we showed some initial positive results, and then we subsequently kind of moved that more to a randomized clinical trial, and we had 24 kids, and they participated in that. And what we found overall, if the graph will appear, maybe.
I think you'll have to click a few times.
Besides my technology, yeah, there we go. You actually see a lot of people got better. So not only did they experience a significant improvement in kind of how tics were impairing their lives, you see in the kind of bright blue piece, but you also saw that there was an overall improvement in their quality of life in comparison to this waitlist condition. So after just kind of 10 sessions of learning these skills and practicing them, most people exhibited an overall, great treatment response, and really had reduced impairment and an improved quality of life. That's great. That's awesome. Fantastic. I'm done. Right? Oh, no. Right. Moving forward together. So yeah, it was being a little facetious, and it works way better when there's an audience. But how do we kind of take this and move this to the next step? This was just a single trial. This is something that I did in graduate school. And it was with 24 people, and then 8 people before that. We really need to replicate and build on these findings, incorporate other people's perspectives to kind of identify skills that would be helpful for patients and families. And examine, this again was focused primarily on children, 18 years of age and younger. How does this kind of work for young adults? People who are at Joseph's age, people who are a little bit older, who are entering the working world, who are entering college. How can we help kind of build them and support them through this? And do they even need that? Because there may be some additional modules that we need to specifically target to help them kind of build and succeed. And that, again, is thinking about where the tics are getting in the way, where the other challenges are getting in the way, so we can give people the skills that they need to really thrive. I think the biggest thing to kind of remember is this: therapy works. This therapeutic approach, gosh darn, works, but only if the skills are used. So there were some people that didn't get better in that study. Just like there's some people that don't get better in every study. And it really goes back to if the skills are used. Because if you're not using the skills, you're most likely not going to get better. And if they're used consistently, so people kind of come and see me and they'll say, Dr. McGuire, I did what you taught me. And I'll be like, great, how often have you been doing it? Well, I just did it once. It's like, yeah, no, this is about practice. Practice, the more you practice, the better you get, provided that you practice in a consistent manner in the way you kind of learned. And really moving beyond just doing it once, but integrating these kind of skills and really building a lifestyle around it. So you're moving beyond just kind of managing and really thinking about kind of a holistic approach. And this isn't just a kind of patient-oriented treatment. It's really focused about the patient, teaching the skills, but also involves parents, right? Because it's not just a single person kind of going with this. Partners for significant others, friends, schools, work allies, it's really going beyond just the individual and really getting back to Joseph's point, education and really building a community. It wasn't just a single, club that he started just for Tourette's. It was really about kind of building all of mental health and mental awareness and building allies, and educating people to kind of get this together. One thing that we're starting to also explore is how technology can kind of play a role, to enhance skill development, to help you kind of be better at kind of practicing behavior therapy skills, looking into ecological momentary assessment, to monitoring mood and targeting interventions in a way that could kind of be helpful. So you can get a little reminder prompt on your smartphone to practice mindfulness if that's a skill that's helpful to you, or if certain times of the day that are particularly challenging, little tips and kind of tricks that could be helpful in those specific moments. And really what this can kind of do is help to build in the moment access to skills, to give people more of an opportunity and more of a chance to kind of use those skills. Because again, going back to that previous slide, the more you practice, the better you get. But that, I think, is the biggest thing. And I wanted to thank you guys all for listening, for Joseph for sharing his story. And I think we'd be delighted to kind of open it up to questions. So thank you.
Okay, great. Thank you both so much for such an excellent presentation. We're now going to begin answering the questions submitted throughout. We likely will not be able to get to all of the questions today, but please know that we do have a full-time information and referral staff who can answer your questions. You can email support@tourette.org or call us at 1-888-4-TOURETTE at any time, and we will make sure that we answer your questions. Also, I've downloaded the PowerPoint and under the handout section of your panel on the right-hand side. So one of the first questions that we have here is for Joseph. Joseph, I see that you're a rising leader with the TIA. How would other young people become a rising leader and share their experiences?
Yeah, so to give some context, the Rising Leaders program is for, I believe, people ages 18 through 25. So the Tourette Association of America offers these two great programs, the Youth Ambassadors program, which is for kids and people under 18, and then this Rising Leaders program is for 18 through 25, like I mentioned. So they offer it on a yearly basis, and there's an application process that I can't tell you the exact time that it ends. I believe, Chelsea, correct me if I'm wrong, I believe this year's training, because it usually happens in the summer, has been delayed to next summer.
Yes, unfortunately, we're not quite sure when yet. We're hoping to do it before next summer. We're hoping to try to do it in conjunction with our March Youth Ambassador training, but unfortunately, due to everything going on, we have had to postpone for now. But we love the program so far. It's been, I hope that Joseph feels that way too. It's something that we're really proud of, and we look forward to continuing to train people moving forward.
Yeah, and the program just has an application process, and then you'll find out if you were accepted. And they will cover costs to get you down to where the training is going on. It was in Florida last year, and it's great because it gets to put you together with a community of people that are also dealing with your circumstances. I know someone that I was texting just last night described it as a once-in-a-lifetime opportunity, and we still keep in touch, all the Rising Leaders from last year. It puts you in contact with opportunities to kind of be an advocate, and yeah, it's a great program. Just keep an eye out for the application process.
Great. Thank you so much, Joseph. And another question for you that we just got. How did you get connected to your mentor? Someone wrote in, their son is 10 years old and a mentor would be amazing.
Yeah, so for me personally, it was a really interesting story because I was so early into my diagnosis when I was going back into school, and it kind of got to the point where I shared my story with certain teachers that I was struggling with texts. Once I got to that point, I didn't know anything like a 504 or an IEP was, and eventually I went to a good school, fortunately, and the faculty knew Logan because he's such an upstanding student that was such an advocate for himself, and they put us in contact with each other. But what I would recommend is, if you're going about the 504 IEP process, of course, all that information is private with the administration, but you can talk to them and see if they're open to kind of contacting other individuals anonymously just to see if they would be interested. We're also looking into local Tourette chapters just to see. I know at Vanderbilt in Nashville, I've gone to some of the Nashville meetings, and it's a great way for those kids, even if they're not at the same school, to still meet up with each other, and I can interact with them as a mentor there.
Great. Thank you so much. And yeah, just to echo what Joseph said, you can visit our website, tourette.org, to look to see if there are any chapters or support groups in your local area. And if you're not sure, you're not able to access that information, feel free to reach out to us directly at the Tourette Association, and we can try to help connect you to some people in your area as well. Our next question here is for Dr. McGuire. Dr. McGuire, you mentioned the possible benefit of technology to help build resiliency skills. Can you tell us a little bit more about what you mean with that?
Sure. So I think technology is a tool and not necessarily a solution to anything. So I want to kind of first kind of put that out there. I think technology plays a really nice way to kind of help, do two things. One, increase access to treatments, right? There's some work that's been done by Mike Kimley and Doug Woods looking, I think it's tickhelper.com, to increase access to behavior therapy or comprehensive behavioral intervention for tics for a wide different, for people who don't live near one of the Tourette centers of excellence. So I think technology in that way can kind of be helpful. The way I was thinking about it is the two biggest challenges that oftentimes a lot of the patients and families I see experience are one, it's really hard to remember to use skills in the moment, right? So if you had certain times of day that we could monitor your mood throughout the day and then send you little messages, which is called ecological, meaning you're in your environment momentary assessment, then we can give you little nudges to remember to use your skills. So for example, if we know that after school there's usually somebody that causes a lot of problems or teases you, sending you a little push notification to let you know, hey, remember, here's the things that we talked about, or here's skills, helpful ways to deal with somebody who's picking on you. Things like that. For kind of, we're also exploring different ways to kind of use smartphones and other devices like virtual reality to help build tick management skills. So I think that there's a ton of cool, fun, different things that we can kind of do, because my goal is to not only teach, people good skills, to make, really evidence-based treatments, but also to make therapy fun, because I think it's hard work. So that's enough of me prattling though.
Oh, great. Thank you so much. And just to kind of take that a step further, we had another question. Dr. McGuire, can you speak to potential treatment options for teenagers with tics that have not responded to medication in CBIT?
So really good question. So thank you. And I think that's a common one. And what I would kind of say is there's a couple different things to kind of think about. One, so I'm a psychologist, not a psychiatrist. So I do the behavior therapy piece, and I have many, many fantastic colleagues who do the medication piece. The first question I would have is really, was the therapy and was the dose, great? So for medication, were you at an optimal dose? Was it long enough? Whatever that medication was. For behavior therapy, there's a lot of people who've come to me and said, Dr. McGuire, I failed behavior therapy. I can't, do it. It doesn't work. And then when we kind of get down to it, there's usually some pieces about, behavior therapy or CBIT that weren't fully conveyed, or somebody wasn't practicing, or there was some miscommunication. So there's usually still some benefit. I would say that, just because, you failed one therapist doesn't mean you failed therapy, or one therapist didn't get you better. That doesn't necessarily mean you failed therapy. And that doesn't mean that I'm the greatest either. There's many other people who work with other people after me, and I'm sure have said, Dr. McGuire doesn't know what he's talking about. And then somebody else worked with him and got better. So the fit, because the fit is also an important thing for therapy. So if it's not there, to kind of think about that. And then going beyond that, if behavior therapy, even after you've tried it, once or twice with different people, if it's still not working, if meds aren't providing you benefit, kind of taking it in really the heart of the presentation, is really saying, well, it's not so much about just tics. It's really thinking about that quality of life. So if I'm still going to have tics and, it's hard to manage them, totally get that. How do we kind of build those other kind of skills to kind of improve my quality of life and reduce the impairments that tics kind of cause me? And that's really what we're trying to kind of get at with, that kind of treatment that I just talked about.
Great. Thank you so much. And we do have time for a couple more questions here. This question is for Joseph. Joseph, how did you go about starting the support group at your high school? What did that process entail?
Yeah, so I would guess that this probably varies based on the school that you go to. But at my school, we just had to find a faculty member that was willing to sponsor our organization, which usually that just entails a teacher that you're close to and that's understanding of situation. And then, it's kind of involving you stepping up. So you have to go into and saying, how can we increase the publicity? How can we go about the process to, getting administration to let us put up posters around the school, or, setting up contacts with school news so you can get in that outlet. So it definitely varies by school, but the number one thing is definitely to find a supportive faculty member that is willing to work with you or your parents.
Great, thank you. And then Joseph, we have another question for you here. Do you have any advice for a 16-year-old who struggles to acknowledge his diagnosis and shuts down attempts to work with his self-advocacy and social emotional well-being?
Yeah, so I will say that in my presentation, I talked a lot about coping through academic methods. But at the same time, I think that this might not be the answer you necessarily want to hear. The adversity that people deal with, I think, is something that's very variable in terms of the timeline of how people want to deal with it. And I think some people need to take the time to cope in their own ways. But at the same time, I think in my experience, oftentimes it's important to have that self-navigation where I was picking the things that I wanted to do, not necessarily my parents, but I had the outlets in which I could engage with my tics in a positive manner. So doing that science fair research or writing about my experiences helped me a lot, and it wasn't kind of controlled. I kind of chose to go about it in my own way, which I think is really important for having that empowerment to make sure that you're doing this of your own volition. But definitely just having the resources available and again, having access to that community, I think was something that really, really helped me and engage the conversation of my own Tourette's and my adversity in a way that was more natural than just having it sort of instigated necessarily by other people kind of outside of my own volition.
Great. Thank you so much. And then we have time for one more question here. This is for Dr. McGuire. Dr. McGuire, what are some of the common challenges that you see young people with Tourette and their families struggling with in your practice?
Really, I think it's pretty variable, to be perfectly honest. I think, the ones that I probably see most are relating to kind of social challenges and school challenges. How do I talk to other people about tics, right? Which I think is a really sensitive topic. Some kids will say, well, am I supposed to disclose? Am I supposed to kind of be at the forefront and kind of take, in some ways, as Joseph's kind of talked about, being an advocate and saying, I have Tourette's, this is what's going on. What if I don't feel like doing that? Like, what if I don't want to kind of share that? How do I kind of deal with this? As a parent, what do I disclose about my child? Do I tell other families, oh, my son or my daughter has Tourette's? Or is that a disclosure, the kid should make? So, I think there's a lot of things that people don't really kind of fully think about. And I think, for example, it could cause a lot of strife in a family if, a parent kind of discloses to another parent, that their son or their daughter has, tics, and that child doesn't want that, no. Right? Imagine you're going to go over to a play date and it's like, oh, well, you're different. That can be really off-putting. So I think having those conversations, thinking through those things, or these social challenges are really kind of tough. Or even if you're a young adult, how do you manage tics in the workplace? How do you kind of talk to people about it in the college classroom? What's your level of kind of comfort? And I think, Joseph's a great example of kind of, navigating those challenges. So, I think a lot of people have innate abilities, but I think there's also some challenges that, deserve a lot of thought to kind of get through.
Great, thank you so much. And I know we have so many questions and wonderful comments that were submitted that we didn't get to today, but just know that we have seen them all. We wish that we could have time to answer them all today, but you can reach out to us at support@tourette.org, and we'll be happy to find that information for you. And thank you again so much to Dr. McGuire and to Joseph for an excellent presentation. That's all the time we have today, unfortunately. Yes, thank you guys so much. Just know that once the session is closed, everyone, you will receive a survey for the presentation. We would greatly appreciate if you could complete that and provide your feedback for us. so that we can improve future programs such as this one. You're also going to receive a follow-up email within 24 to 48 hours that has a link to view the recording of the session. And within the week, we will also be uploading all of the sessions onto our YouTube channel. We encourage you to please reach out to us with any ideas, suggestions, and feedback on this virtual conference. This was our first time doing this. The presentation was presented free of charge, thanks to our generous donors. And if you appreciated this session, we welcome you to support the organization. You know, now more than ever, it's so important. You can visit us at tourette.org to learn more about donating. And on behalf of the TAA, thank you so much again for joining us today and for taking the time to do our presentation. And thank you so much, Joseph and Dr. McGuire. Everyone have a great day.
Yeah, thank you guys.
Take care. Bye-bye.